Today, I want to talk to you about chronic kidney disease or CKD. CKD is a long term condition where the kidneys don't work properly or are damaged. For someone to be diagnosed with it, the problem has to be at least 3 months. In the beginning, there may be no symptoms at all, but as the disease gets worse, people might feel tired, have swollen legs, vomit, or feel confused. CKD can also lead to other problems like high blood pressure, bone issues, and low red blood cells, also called anemia. It can also increase the risk of heart disease, and in serious cases, it can lead to kidney failure, which may need dialysis or a kidney transplant. It is important to know about CKD early so people can get the help they need. Thank you.
Now, let's look at the causes of chronic kidney disease or CKD. Chronic kidney disease occurs when a disease or condition gradually impairs kidney function over time. This damage usually worsens over several months or even years. There are several major causes of CKD. Among the most common causes are, firstly, type 1 or type 2 diabetes, which can damage the kidneys over time due to high blood sugar levels. Secondly, high blood pressure, which can put extra strain on the kidneys and damage the small blood vessel in them. In addition, glomerulonephritis, which is an inflammation of the kidneys filtering units called glomeruli. Moreover, interstitial nephritis, which is a type of inflammation in the kidney tubules and the surrounding structures. Not only that, polycystic kidney disease is an inherited condition where fluid-filled cysts grow in the kidneys, can also lead to chronic kidney damage. Lastly, prolonged obstruction of the urinary tract, which may be caused by conditions such as enlarged prostate, kidney stone, or certain cancer, is also a known risk factor. In conclusion, all of these conditions interfere with the kidney's ability to filter waste and maintain fluid and electrolyte balance. If left unmanaged, they can eventually lead to chronic kidney damage.
There are a few ways of treating the chronic kidney disease, and one of it is having a kidney transplant. The first step of having a kidney transplant is the patient have to go under an evaluation. They must be assessed to determine if they are a good candidate. This evaluation includes blood tests, heart and lung exams, and also cancer screening. Next, getting a donor kidney. There are two main types of donors. First, often a relative or friend. This will have better outcomes and shorter wait. The second one is the patient have to wait in line, and this can be scheduled in advance and have to wait for a little longer. The third step of the kidney transplant treatment is the transplant surgery itself. This usually takes about 3 to 5 hours and it has a few steps. First, the patient will undergo an anesthesia as it will reduce the pain. Next, the new kidney will be placed in the lower abdomen. The surgeon will then connect the kidney's blood vessels to the patient's iliac artery and vein. The ureter will be attached to your bladder. You might be wondering where the old kidney will be, right? The old kidneys are usually left in place unless they cause infection or other issues. Next, the fourth step is the post-surgery recovery, and this will take about 4 to 7 days. This step is for monitoring for rejection or infection, ensuring the new kidney starts making urine, and to adjust medication. The last step for the kidney transplant procedure is the medication after transplant. They need lifelong anti-rejection drugs such as tacrolimus or cyclosporine, mycophenolate, or prednisone.
Okay, now let's look at several effective ways to protect our kidneys. The first and most crucial step is to adopt a healthy lifestyle. This means we need to make change such as reducing our body weight if we are overweight, eating more nutritious food, and most importantly, quitting smoking. Smoking not only harms the lungs and heart, but it also damages blood vessels, including those in the kidneys. which can lead to kidney failure over time. Small change like walking daily or cutting down on fast food can make a big difference. Next, it is very important to control our blood sugar levels, especially for those with diabetes. High blood sugar can damage the small blood vessel in the kidneys, reducing their ability to function properly. So, people with diabetes should monitor their glucose level regularly and make sure to eat a balanced and healthy diet, which includes fruits, vegetables, whole grains, and lean protein. Avoiding sugary and processed food is also a good practice. Thirdly, we need to manage our blood pressure. High blood pressure or hypertension is one of the leading causes of kidney disease. To control it, we should limit our intake of salty foods, reduce stress through relaxation techniques, exercise regularly such as brisk walking or yoga, and take any medication prescribed by a doctor. When blood pressure is under control, it reduces the strain on our kidneys. Lastly, don't forget the importance of drinking enough water. Staying hydrated helps the kidney to clear sodium, urea, and toxins from the body. It is recommended to drink at least 2 liters of water per day or more if you are physically active or the weather is hot. But remember, balance is the key. Too little or too much water can both affect kidney function.
So, for the conclusion, chronic kidney disease is a serious illness that gets worse over time. Many people don't notice symptoms early on, so it's important to check your health regularly. Controlling blood pressure, blood sugar, and living a healthy lifestyle can help slow the disease. If the kidneys stop working, treatment like kidney transplants are needed. A kidney transplant is often the best option. With early care and the right treatment, people with chronic kidney disease can live better and longer.